about atrophic rhinitis, also named as Ozena. Okay, so what is it and where it can be seen? It is a chronic inflammation in the nasal cavity characterized by atrophy of nasal mucosa. It is a chronic inflammation characterized by atrophy of nasal mucosa and bony turbinate. That is turbinate bones. Okay, because of this the nose get spacious, so it is like this, and if it was like this, it gets, if it was like this before, now it gets wider. Okay, become more spacious and more spacious and foul smelling. Okay, the person actually gets isolated from the society. So what is actually happening here and what is its management? So just write the types. Atrophic rhinitis can be of two types. One is primary, happening because of its own, and other one is secondary, happening because of some infections. So in secondary, if we see what causes, in secondary we have the syphilis, we have to think some dirty things. So we have the leprosy, and we have the sinusitis. Obviously we are talking about nose, so sinusitis. Because of this the secondary can be happen. Now in case of primary, why it is happening? In the primary we can remember as the first thing is hereditary, so it is because of the family. Okay, it is happening due to hormone, that's why it is happening at puberty in females. Okay, it happens more in Asians is in more, and it may happen because of autoimmune, So what happens here? These are the potential etiology. Now talking about the pathology. Here one cell line is replaced by another. So as the name suggests, atrophy occurs in glands, veins, even nerves. I'm just simplifying it. Bone turbinate gets resorption. Bone resorption happens. So turbinate erode wide nose, nasal cavity. Okay, Clinical features. The most important is I have a young teenage female who is socially isolated because of foul smell, foul smelling nose. She is socially isolated, but she herself doesn't know about the situation. She is unaware about the odor due to significant anosmia. Anosmia means unaware herself due to merciful anosmia, a absent of nose. Okay. Socially isolated female, isolated from society. Okay. Nose is widened but obstructed as well, and bleeding, nasal bleeding, known as epistaxis. So on examination, what I found on examination, this is the picture cast in the nasal cavity. So let's write them. On examination, I find a greenish or grayish black dry crust. Greenish crust. Okay. On removal, bleeding can occur. Greenish, grayish, black, dry crust. On removal, bleeding can be occurred. Septal perforation can happen. And nasal deformity can happen. Obviously the nose is having so much trouble. Along with that, I can have atrophy in pharynx and larynx as well. Atrophy in pharynx. So atrophic pharyngitis and atrophic laryngitis. I can hearing problem, impairment. Okay, so it is written as impairment, and that's enough, I think. Prognosis, it gets resolved automatically in middle age, improves automatically, so spontaneously in middle aged, आंटी हो जाने के बाद. Aunties. Next is the management, okay, of Ozena. So I have the medical management, I have the surgical management. So if I talk about the medical management, so obviously I will put water that is normal saline pushed through one and out from another nostril, that is known as irrigation. Talking and writing makes so many mistakes, spelling mistakes. Next is another solution can be given, that is 25% glucose in glycerin. Okay, one can be given as anti-Ozena solution. We have esterol spray, that is estrogen, esterol spray, that is steroid actually, for revascularization and repair, regrowth, not regrowth, repairment, regeneration of glands. Okay, I have surgical, that is first is the Young's operation, completely block both nostril. Second is modified Young's operation, so it is partially block, obviously close the nostrils. Why we are doing this? For reversal of mucosa. Okay, and the third one is narrowing the cavities, nasal cavity. So I can give multiple things. I can insert fat, bone, etc., cartilage. Or section and medial displacement, displacement of lateral wall of nose. So that's it.